Welcome, ACSA family and friends, or welcome back, as it were, to Common Purpose, Uncommon Times. As always, Wes Smith, proud to serve as your executive director. We did take a couple of weeks off to give you time to get back to whatever back to school looks like, mostly virtual, some dreams maybe of hybrid, maybe some small cohorts. We'll talk about that briefly tonight, but most importantly, welcome back. We're glad you're here, and we love finding resources to help you better serve the adults and students in your care, and we have that tonight. Elizabeth Estes and Alex Briscoe are amazing. They're going to be sharing some resources related to mental health support, behavioral, social, emotional. How do we actually support that work? We know it's important. How do we support it? I'll remind you all throughout, you know how this works. If you have questions for them, please put them into the chat. If you have questions for me as well, put them into the chat. And we'll try to answer those as we go. Let's do a couple of updates, though, before we get into tonight's content. I want to make sure that you know each week on Tuesdays, we have our ACSA campus tour. This week, we have the high energy Buck Rogeman from Forest Grove Elementary. He'll be doing our campus tour. Wednesday, we have Naj and Edgar Zazweta, our head of GR. They often have some folks chiming in about advocacy. And that's our legislative lunch break. And that's 1 o'clock on Wednesday. And I say dial in, tune in, and ask them really, really tough questions. We don't want Edgar and Naj getting lazy. All right. So tune in Wednesday. I want to let you know as well that ACSA Personnel Academy, it is open right now. It is September 29th through October 1st. And you can find registration information, by the way, at ACSA.org/professional-learning. And we're going to put that up. We also have registration open right now for our first ever, we're in a lot of those first evers this year, virtual leadership summit, which is going to be November 5th through the 6th. Don't have to announce the city because it's whatever city or town you are in. But both of those events, you can sign up for them right now at ACSA.org/professional-learning. A couple of things that have gone on this week that we know are causing you work. CDPH came out with their blueprint for a safer economy. They changed some of those rules for getting folks back to work physically. And while there are many color bands, education, we only need to really think about the two, the purple and red bands. And really what they did was they just made you take more time, 14 days of meeting the criteria, and then 14 days being out of the color band before you could consider coming back physically. They also came out with the elementary school waivers. It was kind of interesting to note that CDPH put out the data on that this week, and we didn't see any public education schools applying for that waiver. Certainly a lot of privates and some charters. And so we'll be monitoring that and seeing how we can help you. Again, these are options only, and only if you can keep your folks safe. The adults who serve your students and your students so that you can protect your communities. But if you can, then we want to help any way that we can, either interpreting the CDPH guidelines or helping you with the process. We also got guidance on the small cohort. Again, for those of you trying to address the needs of cohorts, perhaps students with disabilities that we've discussed on this show before, whose needs are really difficultly met in a virtual environment, or English language learners. I know in the San Jose area, they're doing migrant workers and their students who don't have access to the technology or infrastructure. So they're bringing them into cohorts to do the work. But we can help with that as well and clarify. And then here's good news. The CDE template for attendance confused and upset a lot of people. Remember, it's just a template and it's just guidance. It wasn't a mandated template, but they have listened to your advocacy. to our GR team, and they're looking to perhaps, fingers crossed, take some edits on that, so that you can spend your time during the day instructing and supporting and not filling out documentation, because we have so little time comparatively with our students. We can't afford to waste it. So our team's done a great job there. Lastly, before we jump into the topic, and it's somewhat related, our state is hit yet again by these devastating fires. This could be wrong because it's changing by the minute, but the last time I looked, we have the second, third, fourth, and fifth largest fires in the history of California happening at the exact same time. Some of the folks are dealing with trauma yet again because they're near a fire, or it's threatening their community again, or as Deb Cuban was saying in Lake County, it could be just the smoke and air quality that is causing the adults, students to once again experience trauma. Berry Creek, the community, was totally decimated by their fire. And we want you to know that ACSA is there to support our members. And we want to help you because we know that you want to help your members. And you might be sitting there thinking, but how do I do it? I want to help. How do I do it? Well, here's how you do it. Go to www.axa.org/crisis-support. They're going to put that link up there, axa.org/crisis-support. You can do a variety of things. You can sign up to provide temporary shelter for our ACSA members who lose their homes, provide personal necessity items to them. You can even sign up to provide support or knowledge. Some of you have dealt with this. I'm thinking of folks like Tim Taylor and his experience, Mary Sakuma and others, Deb Cuban, who I mentioned, folks that have dealt with this, Amy Alzina in Southern California that have dealt with the crisis. How do we help our colleagues? Well, if that's what you can provide, we want to avail that support to our members also. And this is important, we can donate to an ACSA partner link with the Red Cross. So please, if you have the resources, get on and support. Funding matters. Rebuilding takes resources. And you and we can help our colleagues who are sorely in need right now. Let's jump into tonight's topic. Again, really excited to have Elizabeth Estes. She's the founder of Breaking Barriers. And Alex Briscoe, who's a principal at California Children's Trust. And they have helped ACSA in the field for forever. That's not to say they're really old or anything. They just have helped us a lot. They were a part of our task force, our mental wellness task force that provided resources to the field. They helped us there. They've been at Leadership Assembly. We're really grateful for them and their expertise, their willingness to take time out of their busy lives to provide some support. So let's do just that. Let's provide some support. And Alex, I want to start with you because I was just digging through your website and saw some stunning data points. A couple of things I read that just really stood out. Only 5% of children with Medi-Cal receive behavioral health service. That only 35% of youth in California who report needing mental health actually receive it. That we're 43rd, California, again, the first largest economy in this country, the fifth largest in the world. We're 43rd in providing behavioral, social, and developmental screenings. And yet the need is great. 104% increase in inpatient visits for suicide or suicidal ideation. 50% increase in mental health hospital days for children. So, Alex, we know things are stressful. Your data points that out. Speak to the gravity of the mental health, mental wellness situation right now.
Well, thanks, Wes. Yeah, the term crisis is used far too easily. But those data points all come from before the pandemic. And I know it's not news to teachers and school administrators and other folks in education that schools are ground zero for the crisis that those numbers reflect. And at the heart of it is an understanding that this is new. Most of that data represents the decade before the crisis hit. So there's something going on with kids. Our young people are telling us through the California Healthy Kids Survey and through how they're showing up in our health system that they're hurting, that it's hard to be a kid in this culture, and they're not getting the support they need. So at the risk of dwelling too much on those numbers, because they can dehumanize the suffering behind them, and I know, again, the people listening in tonight know it as well as anybody. This is one of the reasons we're here tonight, is to talk about the hope that schools represent as places of healing and support if properly resourced. So the last thing I'll say on those data points is those data points also represent a period of time in which Medi-Cal became the dominant health insurance payer for children in the state. So it's critical for the listeners to learn tonight that 6 out of 10 children in California are now covered by Medi-Cal, including undocumented children. And that's a 30% growth in the last 5 years. So if you have historically looked at Medi-Cal and said to yourself, wow, it's too complex, the juice isn't worth the squeeze, some of my kids aren't eligible, more are eligible now than ever before. So making this work is more important than ever before.
Wow, Alex, I was worried that you were going to say that data represents a time pre-COVID. And that's exactly what you shared. I mean, you think about everything now since then that folks are dealing with, right? The COVID, the impact on our economy, with parents working, with food inequities, et cetera, et cetera. Now we have fires. And I love what you said about when appropriately resourced. We've got to get that quote and put that in one of our chats or something. I mean, yes, if we're appropriately resourced. Elizabeth, let me. I don't like to read to people very often, but you had a great quote that I wanted to share with our ACSA family. You said that insufficiently addressed early trauma and inadequate support for children's social, emotional, behavioral needs too often derail learning and healthy development, resulting in disrupted homes and communities, and ultimately setting kids up for a lifetime of struggle. And then you went on to describe that those varied agencies, those varied actors that are out there trying to support, they're doing it independently. So can you speak to certainly the gravity of the situation, as Alex did, but also how we might create better synergy in California, a network of support, if you will?
Yeah. So I founded Breaking Barriers out of my own trauma. So my own experience with trauma and PTSD and fight to recovery. But also I've been an attorney in the children's system for 26 years in California. The first 5 years I spent representing minors in the dependency system in LA County. And the past 21 years, I've represented the public schools in California with a specialization in special education and social emotional behavioral health program development. And in that experience, having crossed over between different child serving systems in California, what I realized was that we're not aligned in our care of the children of California, despite the fact that we serve them simultaneously. We don't necessarily serve them together. And there are resources available to them across different child serving agencies in California, whether it's social services or probation or behavioral health or education, that are not interconnected. And because of that, children and families fall through the cracks. They can't navigate the system that we've built for them, and we can't build as robust a system as we need. And it became critical for me about 6 years ago to start talking about that disconnect as I was representing education and realizing that these children hold multiple entitlements that they are not accessing as we speak. And that if we could reach across the aisle and start to figure out why we don't have a comprehensive, robust system maximizing the utilization of all those services, we might be able to assist them better in education. And as we know, if we don't intervene early, we change the trajectory of children's lives forever. And we're very much a wait to fail system. So part of the work is figuring out that prevention and intervention that, we've all been talking about, in that tier 1, tier 2 in the education space that we all talk about. And in order to do that, we have to have partnerships with the other agencies and players in our communities in order for us to do what we do for children and families. And that's actually how I met Alex Briscoe, sort of roaming California for the people from other systems who saw that same possibility and that same need. And Alex came out of the behavioral health and human services side of all of this, and has been just an incredible ally and mind in doing a deep dive analysis into the potential for expanded financing for a comprehensive service delivery system. But the one thing I would say about possibility is partnership is critical. Relationships and partnerships are critical. We've seen them expand over the past 5 years in ways I don't think I knew would happen when we first started talking about all of this. But figuring out what you want your robust system to look like so that teachers can teach and administrators can administer and students can learn and families can be whole together with your partners is critical. It's as critical as the financing.
Well, we don't have the time tonight, but I'll tell you, while our members are always given new things that they have to do, it seems like they're asked to be, instructional leaders, master planners, et cetera, toasty dog chefs, whatever it is they're asked to do. ACSA, though, could maybe convene these groups. I'd love to carry the conversation on with you about how we might be able to bring people together and be a unifier of these varied supports for folks. But let's dive into this issue of resources, because it certainly is the elephant in the room. And where a lot of people have worked on improving direct services, and certainly that's something that you're both aware of, you focused as well on this resource side, increased funding, resources that folks have. And Christine Benitez asked a question about counselors and described some trauma that they're going through, and certainly ACSA supports more counselors and more adults there to support students, and even the big picture funding things. Again, 5th largest economy in the world, and we're 43 out of 50 in per pupil spending. We can do better. But beyond that big picture, Elizabeth and Alex, let's talk about some of those resources for folks doing the work. And Elizabeth, we'll start with you this time.
Well, I would say one of the resources that, we very intentionally developed together was the practical guide that we, wanted to speak about this evening, a practical guide to financing social, emotional, and mental health services for the children of California, and really to maximizing Medi-Cal billing and expansion of that billing in order to build a more robust continuum for children in California. And within that guide, we actually also incorporated links to other information that we think is important for the field to understand in order to build a more robust continuum. And I would say now is such a challenging time. I advise school districts across the state of California, and the burdens are great on all of us. But it also, as we've deconstructed the system and been forced to build relationships with some of the other partners that are in our counties, I think we have opportunity to reconstruct in a way that we haven't before, in a unified way that we haven't before. So I would say the guide that we just put out does incorporate a lot of information that I think will be helpful. We hope so.
Yeah, and thanks for putting that link up, by the way, so folks can pull that up right now. As we say, we want people that tune in to Common Purpose to be able to take something tonight to implement tomorrow. So thank you. Alex, do you want to speak more about that, about some of those resources in the guide? And I know people are asking questions about, wraparound services, it's certainly we all care about, and we've promised our communities coming out of the Great Recession, and yet we haven't seen a lot of those. Perhaps it is a resource question, amongst other things. So go ahead. Some of your thoughts about resources from the guide.
Yeah, well, there's a bunch of new opportunities available to school leaders, but I was struck too, Wes, by your comment about all the roles we ask school leaders to play. From, you listed a number of them. You didn't say therapist and doctor, but you could have.
Yeah.
Because young people's behaviors are happening at school. And at school age is when kids have the lowest rate of primary care utilization, meaning they go to the doctors the least. So we actually have to find ways to bring services and supports to schools because that's where kids are. And just as one way to frame it, because we can't dig all the way down the rabbit hole of Medicaid in a very short presentation, is to think of, in your mind as a school leader, 97% of the children in California are insured and covered with a mental health benefit. So whether they're rich or poor, white or black, they are currently enrolled in a health plan that pays for mental health services. And as a school leader, one role for you is simply to be a difficult advocate, to ask the hard questions of, if my children have needs, why aren't they getting served? So I know lots of school leaders immediately want to talk about how to build Medicaid, how to co-locate therapists, how to build programs on site. And there is lots of information in the practical guide on how to do that. And I'm happy to talk about that as long as people want to. But I would also offer some counsel, which is you can be an advocate. You don't have to do it all. When children fill out that emergency contact card and they show up on their school site, they write down the name of their primary care doc and their health insurance on the back of that card, usually. Some school districts are doing really interesting things with digitizing it. And that information is essential. That is a tool for you as a school leader to access that you don't have to pay for, but a child is entitled to.
When I'm in the field building out continuums, I ask, who are the insurance coverage carriers for the children in your school district or county office or whoever I'm working with? And oftentimes people will ask me why. Like, why are you asking me that question? It's a critical question, as Alex mentions, to the partnerships that we can build and the possibilities. And we've seen the development of much more robust systems when we reach out and create those partnerships. That advocacy role is critical too for education. I think we can be advocates for a more robust system.
That's a great point. And Alex, you're right. There's so many things we could have added, and our folks are being asked to be therapists and counselors and doctors and scientists and immunologists these days. I mean, it's more and more and more. And I know that our folks are feeling overwhelmed. And, as we're thinking about these supports for students, one of the topics we also bring into play here are those necessary supports for the adults serving the students, because they too are, man, they're feeling it. They tell us all the time. You can read it in some of the questions tonight. We are just into this year and folks are feeling it. I don't know if you had anything to say about the impact on adults or resources there. The advocacy part is big. Elizabeth, wanted to give you a chance too, if there was something folks could do tomorrow besides advocacy, what that is. But I'll throw out about 3 questions at once then and let you guys unpack it, because you're the experts. What say you?
So on the advocacy front, when I say advocacy, I don't mean just advocacy for the entitlements that children hold. I mean advocacy for us to realize those entitlements and services for those children, so that we in education, the educators that I work with and the administrators that I work with, aren't trying to operate in a system that doesn't have access to those services and supports. We should have those services and supports embedded in our schools and on our campuses so that we have more concrete support on the ground. And so, as Alex talks about being 43rd in the nation, but yet we have more Medi-Cal eligible children than anyone in the nation, but we're 43rd in billing. I mean, that's tragic. And I think having that conversation with your local public health department, and Alex can speak more to that for sure. But reaching out and having that conversation about what data, what does that look like in your particular area, in your particular county, and how can you access and maximize more of these children's entitlements and bring that onto our school campuses is something that people can do tomorrow. They can start having those conversations tomorrow, and they need to. When I train at ACSA, and I often say, EPSDT, which is a children's entitlement, a lot of people will say to me, never heard of it, don't know what it is. Like, I don't know that that's an entitlement that our children can currently hold for service delivery. And I think we have to educate ourselves and then start asking questions of our partners regarding how we can unite to bring those resources to our campuses and to everyone who's working on those, because that's what we need. Even those of us that are traumatized by what we're trying to tackle, which we are.
Yeah, I love that frame, Elizabeth, that knowledge is power. Like, one of the most important things you can do as a school leader is learn the child serving safety net in your jurisdiction. So that means know the name of the mental health director, know what health plans serve your children, know what community-based mental health providers are in your jurisdiction. So that learning is really important. And if you dip into the practical guide and you start thinking in your head, hey, I got a lot of poor kids, I want to learn about Medicaid, there's basically 3 things to hold. You can bill yourself as an LEA. That's called the LEA option. You can try to connect to your local mental health plan. That's your county behavioral health department. That's the mental health plan option. Or you can interact with the new sheriff in town, which are the health plans. Almost all children in Medicaid are enrolled in what's called a managed care organization. So when you think of Medi-Cal, 3 places will bring you new money for your school site. Your own billing. So if you're a school, you should know if you're in the LEA program or not. You should be able to answer that question. The second is you should know the name and phone number of the local mental health plan, the county mental health department. And the third is you should be starting to build relationships with the managed care organizations or the health plans that your children are enrolled in. Lots more in the guide.
we can't draw too fine a point to that. The guide has been, I'll have the team put it up there again. It's a resource. People can take it, implement it again tonight. Let's go to Alicia Padilla. Asked a question about the summer months. How do we continue to advocate during the summer session these supports that our students need? Do either of you want to comment on that?
Yeah, I'll just make a quick comment, and I know Elizabeth will, I'm sure, want to add, but that's one of the beautiful things about the nexus of health and education, is that health is 24/7 and continues. Medicaid doesn't shut off in the summer. So while schools are a great place to provide services, particularly for higher need kids, a great way to keep them engaged and maintained with pro-social connections, relationship-based services, is through connecting them to their local child serving systems. And this is true for early childhood all the way through adolescence, particularly in adolescence. So Medicaid is a great way to particularly community-based mental health services, is a really important partnership for your high need kids to maintain them during the summer until their communities reform in the fall.
Yeah, I would absolutely agree with that. And I also think that, I work with school administration all year long through the summer months. And I think the summer provides us, if we take the opportunity with the time to have conversations with some of those partners that are out in our communities, to develop a more robust service continuum when school starts again. And so I think it's a time for planning in education if we do the outreach.
Awesome. We like to, go ahead, Elizabeth, go ahead.
One thought, special education, this work can help us with special prevention and early intervention, particularly can help us with special education. And this work of reaching out and providing a more robust service continuum can help us with special education and the rising costs associated with serving those children, and also the rising compensatory education costs right now. that are mounting. And so I see a real urgency for education to be doing this advocacy, outreach, and program development as we speak. And yeah.
No, thank you for that. We talk so often about the individual issues, and yet we're about the whole child. We're about the whole system, which is, what you're saying tonight. Thank you for bringing that up. We've talked about students with disabilities on this show. We've also talked about the fires, but looking at whole child, whole system supports. That is so very, very important. Look, we end each week with something that gives us hope. I have hope for a variety of reasons relative to this topic. That we have members that have the foresight, like Holly Eads and Lisa Gonzalez some years ago, to say we need to convene a task force to look at mental wellness long before there was a COVID. And so they put us in a good position. I have hope because we have partners like the two of you that are willing to come and share your expertise with our members in a practical guide at leadership assembly, at conferences. Here you are in the evening when I'm sure you could be doing other things like, taking care of your dogs or whatever that was going on in the background, right? But you're here with us, and that gives me hope. And I also have a lot of hope because I've got an amazing team. Over the weekend, I messaged a couple of the member services and communications and said, hey, I've heard about this district. Have you reached out? And almost every time I try to tell them there's a district out there that needs help, they message me back, Wes, we've already reached out. We're in contact with them. I'm grateful for our members. I'm grateful for our partners. And I'm sure grateful for my staff. And it absolutely gives me hope, even and especially in this crisis. Elizabeth, what about you? What gives you hope?
You guys give me hope. Like, I would say that the people that I work with in the field, in the schools, that are leaders and innovators and tackling, this work and serving children and finding ways to navigate this new world that we're living in. I call it the matrix. I mean, you can't sort of get your mind around it. They give me hope. I mean, we can do this. I know we can do this. And I don't say that because I can do this. I say that because I know the people in the field. I've been working with them for 26 years, and we can do this if we unite and put our resources together and our minds together on ways to support one another and to support the people we serve. So that's who gives me hope. That's what gives me hope.
Awesome. Alex, how about you? What gives you hope?
I'm going to cheat and say two things. The first thing is that the financial incentives align with the need, meaning there are more kids on Medicaid than ever before. Schools are struggling, kids are suffering. And when there's a way to pay for stuff, even if the plumbing is broken and we've got lots of work to do, change can happen. So there's a new state plan amendment that allows you to bill for more kids. There's new opportunities with managed care. So there's actually movement. I know it seems slow and agonizing to folks on the front lines and watching children suffer, but as someone who's been in this space for a lot of years, I'm actually seeing things happening in new ways. So I'm very hopeful that the financial incentive is finally aligning with the need. But the other and maybe most important thing that gives me hope is that there's lots of stuff that can be done with no money. A beloved friend of mine was running a school after a natural disaster. I went to visit him. Not enough of the teachers had come back. And I walked onto campus and the seniors were running homeroom for the freshmen. And while the kids were walking across the quad, I heard this senior yell, yo, you better get to class. You can't be late again. And I was reminded, and even Wes, in your comments that opened the show tonight, that when needed, we look out for each other. There are ways that school communities can build social cohesion and capital. We can care for each other simply by deciding that's what we're about. So in your other question about what we can do, teacher to teacher or adult to adult, we can build more caring communities simply by coming together and sharing our experiences. And that may be a more transformative thing to do than getting Medicaid to pay for a therapist for 28 kids, as important as that is. So what gives me most hope is so many of the things I see happening in schools aren't about money, aren't about understanding Medicaid. They're about the beauty and compassion that is our birthright as human beings.
Well, I'll tell you, you're speaking right to the choir, our members, with that, because that's what they stand for. Folks, we've also provided tonight some resources in the guide. If you need some support, again, you can unpack that tonight and get ready for tomorrow. I'm grateful for Elizabeth and Alex. Thank you for coming on. For all of you, thank you for all the work that you're doing every day to support the adults, serving your students, supporting your students, and really supporting your communities in our state. Be safe, be well. We'll see you next week on Common Purpose, Uncommon Times.